Good afternoon, guys. Welcome back. Hope you had an excellent weekend. As you know, we're going to change gears today. We now have the cardiovascular system behind us, and we're going to pick up and move on to the respiratory system because the two are very closely related. As you know, the cardiovascular system is responsible for transporting nutrients and gases, specifically oxygen, and removing carbon dioxide. And the respiratory system is responsible for pulling that oxygen in from our external environment and then eliminating, recycling back to that external environment, that carbon dioxide that is a cellular waste product. So they work hand in hand, and that's why both the cardiovascular system and the respiratory system are linked together for the content for exam number 2. And speaking of, today we'll do the first half of chapter 22 on the respiratory system, focusing more on the parts of the respiratory system, the anatomy. And there really aren't that many, to be honest with you, but they're important. And going over them will help make sense of what we'll cover on Thursday, the second half of this chapter on respiratory physiology. That's going to be a lot more involved, okay? So you're definitely going to want to not miss lecture on Thursday. A little bit of heavy lifting on the physiology side. Okay, so don't miss Thursday if you want to do well on the exam. So after today and Thursday's exams, we'll be headed in toward our break and the second exam already. And believe it or not, that takes us past the halfway point of the semester. Okay, so we are really cruising through the semester. Speaking of the cardiovascular system, I just want to remind you guys,
Recording in
just in case you
progress.
forgot, I know a good number of you have already taken the lab quiz, but remember, today is your lab quiz on the cardiovascular system, that second lab quiz. Like I said, a bunch of you already have it done. That's outstanding. For those of you that don't, make sure it's finished by 8 p.m. Okay? Just don't forget about it. You don't want to leave those points out on the board. All right, so let's go ahead and continue with the respiratory system. Okay, so as I said, the respiratory system works with the cardiovascular system to supply all of our tissues and cells with oxygen and dispose of and eliminate carbon dioxide, which is a waste product of cellular activity, okay? But our respiratory system beyond that, in a secondary function, contributes toward our sense of smell. And of course, because our olfactory nerve leads to our nose, as well as those olfactory fibers and olfactory bulb that we learned about in special senses back in Bio 210. And also our respiratory system contributes to our ability to speak. It's the movement of air across our vocal cords and our larynx that we'll be talking about that allows us to communicate verbally. So 4 basic processes of respiration. And by respiration, we mean breathing, moving air in and out. Inhalation, exhalation, also called inspiration or expiration. They're all suitable terms for pulling gases into our lungs or eliminating gases from our lungs. Okay, those 4 basic processes can be broken down into 2 subcategories. The first one, the respiratory system, okay, and that is pulmonary ventilation is where it starts. One of the subcategories is just literally the movement of air in and out of our lungs, as I just described, okay, and that's through a network of tubes that we're going to be talking about today as we go through the anatomic parts of the respiratory system that are referred to as the conduction zones. They conduct, they allow the movement of air in and out of our lungs. Okay, so pulmonary ventilation is just the movement of air in and out of the lungs. External respiration is the exchange of oxygen and carbon dioxide at the lung level, okay, between the alveoli that we're going to be talking about. They're microscopic, kind of look like bunches of grapes inside of the lungs, and those capillaries from the pulmonary circuit that we talked about from the cardiovascular system that arrives at the lungs deoxygenated, and then of course that CO2 jumps off and the oxygen jumps on, right? So that gas exchange taking place in the lungs where blood becomes reoxygenated, okay? We've talked about external respiration a lot in the cardiovascular system, and again, that pulmonary circuit. Okay, and then within the circulatory system, the cardiovascular system, that's the other part that we've already talked about, the transportation of oxygen to the cells throughout the bloodstream, to the systemic and the coronary system, and then the removal of carbon dioxide from those same cells. And then internal respiration is that exchange of oxygen, the offloading of oxygen out at the systemic level, and then the onboarding of waste product, carbon dioxide, system-wide, okay? So this is that gas exchange that takes place out in the systemic circuit and in the coronary circuit at the muscle of the heart itself. Okay, so know for the exam that out in the body, the tissue cells and blood exchange gases via those capillaries, via diffusion that we've talked about time and again, right? Those simple squamous epithelial tissue cells that allow for the easiest method of offboarding oxygen from the capillaries in the systemic loop into the cells, and then the transfer from the cells of carbon dioxide onto the erythrocytes in the capillaries, making the blood deoxygenated, okay? All right, when we talk about the respiratory system, anatomically, we start by, and you can see this is underlined, so I'm definitely going to encourage you guys for purposes of the exam and also for your lab quiz. I can assure you, you're going to need to know the two categories of the components of the respiratory system, the upper respiratory system and the lower respiratory system, and then know the names of the various components and what they do, okay? And again, that may sound like a lot right now, but it's going to be pretty obvious when we get done today. And then again, over in lab with, we're going to be going through all of these components when we meet again in lab next week, and we'll be going over these same parts. So you're going to hear them multiple times, okay? All right, so let's start with the upper respiratory system and lower respiratory system. Again, that's a major division in the respiratory system. Those of you that are parents probably are very familiar with upper respiratory and lower respiratory because these are common locations for infections to occur in small children, right? You can have an upper respiratory infection or a lower respiratory virus, okay? The upper respiratory system is everything that starts most superiorly with our nose and our nostrils, called in anatomy and physiology terms, our nostrils are called nares. We'll talk more about those in lab next time, but our nostrils, our nares, are an intake port for inspiring air, inhaling air from our external environment and pulling it into our lungs, ultimately for gas exchange, right? Well, once that air, those gases from the external environment pass through our nares and through the nose itself, they enter into the nasal cavity, which sits right behind the nose. And surrounding the nasal cavity are sinuses that we all have heard of. Sinus infections, right? And sinus irritations from allergies. Welcome to the South, right? We all experience these things, especially in these coming months of spring, at least for my family. Okay, all part of the upper respiratory system. And we're going to go through these one by one a little bit in a few minutes. Okay, then as that air following the pathway from inspiration from the external environment. The air makes its way through the nares, through the nose, into the nasal cavity behind it, and ultimately then is going to arrive at the pharynx. And the pharynx is a muscular tube that starts most superiorly right behind the nose and then proceeds downward inferiorly behind the mouth and down into the throat. Okay, and that's called the pharynx. It's just a small muscular tube that connects the nose down to the neck. Okay, and it has three subdivisions that we'll be talking about: the nasopharynx, the oropharynx behind the mouth, and then the laryngopharynx, where the pharynx, it's one continuous tube, transfers and becomes the larynx. Okay, so that's the magic divide point anatomically between the upper respiratory system is the pharynx and above, and then the lower respiratory system is everything from the larynx in our throat below. Okay, so the larynx is also where our vocal cords are housed. So our ability to speak emanates from our larynx and the vibration of air moving in and out of the respiratory system against those vocal cords or vocal folds. All right. Also in the larynx, as we'll talk about, is where our epiglottis is, that cartilage flap that is a traffic director, directs food and beverages down the esophagus toward the stomach, but air toward the trachea. Okay, if we continue to descend and move downward from the larynx toward the lungs, from the neck downward, we next encounter a tube structure that is the trachea that we've probably all heard of. And the trachea is just a rather short tube that ends up terminating at the area of the lungs. And then it bifurcates, it splits into two branches. And these are the first of many branches of bronchi and eventually becoming bronchioles. Okay, and these first two branches are primary bronchi, and then they're going to branch off and separate and become secondary or lobar branches. And then the secondary branches are going to branch yet again and become segmental or tertiary branches. And then they will branch yet again and become bronchioles. And bronchioles are the smallest in diameter of the bronchial tree, that network of tubes that carries gases in and out of the lungs, in and out of the body. Bronchioles can almost be thought of like their counterpart capillaries over in the cardiovascular system. When we talk about the bronchial tree and all of those branches that we just talked about, it's very, very similar to what we talked about over in the cardiovascular system with blood vessels, with arteries and veins. Remember, the arteries were the largest in diameter, but there were the fewest of them, and then they branched into arterioles, and then the arterioles branched off into capillaries. The bronchi and all the branches of the bronchial tree all do the same thing. It starts with a single trachea, and then it becomes two bronchi, a right and left primary, going to the right and left lung, respectively. And then those primaries become smaller in diameter, but more in volume as they become lobar, and then even more branching, but smaller diameter as they become segmental, and then significantly smaller and more as they become bronchioles. The bronchioles inside of the lungs terminate at the alveoli. And the alveoli, again, when I teach, I use, and we'll be talking about them, you'll see illustrations of them coming up. The alveoli to me look like a bunch of grapes, okay? That cluster a bunch of grapes. They're microscopic. They're extremely numerous. There's over 300 million alveoli in our lungs. So they're very tiny, but very important. And the alveoli are the site of actual gas exchange. Okay. over these bunches, these millions and millions of alveoli, is where the capillaries that are coming from the cardiovascular system in that pulmonary circuit, those capillaries lay right on the top of the alveoli. And that's where the gas exchange occurs in the lungs. Okay? So those are the two main divisions: upper respiratory, lower respiratory, and the corresponding parts within. Like I said, there's not a lot of parts and it's not overly complicated. Remember that most of the respiratory system are considered conducting structures, air passages, tubes that allow air to pass through. In fact, if you look at everything we just talked about, all of these except for the lungs and the alveoli are conducting structures. The alveoli and lungs are the only true quote unquote respiratory, where gas exchange functions. All right, so here's just an illustration of what we just talked about. We have the nostrils, the nares, the nose. By the way, the nose is the only portion of the respiratory system that's external to the body. It's pretty unique in that regard. We don't have many body parts that are external to the body, but the nose is one of them, along with the nares. Then the nasal cavity, and then that pharynx that runs from the nasal cavity down behind the oral cavity, the mouth, because we can breathe air in through our mouth also, particularly if we're congested. We have a bad head cold, for example. But for the most part, air is brought in through the nose and food and beverages through the mouth. But then that pharynx descends and becomes the larynx at the epiglottis. And then from the larynx, it moves down through the neck and becomes the trachea. And then we can see that bifurcation at what's called the carina. The carina is this terminal end of the trachea. Okay, the most inferior aspect of the trachea is called the carina. And then that bifurcation, where we had one conducting tube so far, this segment being the trachea, bifurcates and branches and becomes the left main or primary bronchi, or the right main or primary bronchi, going to the left lung and to the right lung. Now, we'll see the further branching in a few slides as we get to that. One thing you may notice here, while the lungs are shown here intact, is that you can see little perforations, divisions on the exterior surface of the lungs. Okay, and these are the actual division points of the various lobes of the lung. Okay, and we can see over here on the right lung, there's a key difference between the right and left lungs. The left lung is significantly smaller in actual physical size and capacity compared to the right lung. Okay, the right lung has three lobes: a superior, a middle, and an inferior, whereas the left lung only has a superior lobe and an inferior lobe. And the reason the left lung is so much smaller is because of this cutaway right here. So it's missing a lot of lung volume by comparison to the right lung. Okay, they're not mirror images of one another. And the reason for that, this area, first of all, and we'll talk more about it, is called the cardiac notch. And it's to accommodate, that's been removed for this illustration, but to accommodate for the resting place, the position of the heart here in that mediastinum, that rectangular centermost body cavity where the heart, the trachea, the esophagus exist. Okay? And then the diaphragm muscle, of course, lies underneath both of the lungs and separates the thoracic cavity above it from the abdominal cavity below it. And the diaphragm muscle isn't technically part of the respiratory system. However, it is important and relates to respiration. And we'll talk more about that on Thursday when we talk about the physiology of how gases are pulled into the lungs and pushed out. Okay? All right, so let's talk like we did with the cardiovascular system. we talked many times about the flow of blood, right? The pathway. With the respiratory system, and I already did this, so we won't spend a lot of time redoing it, but if we trace the flow of blood during inhalation, inspiration, bringing in air and gases from our external environment, the first point of entry is going to be our external nares, our nostrils. And then from there, moving deeper into the nose will be the nasal cavity, as we saw, then to the pharynx, that muscular tube that runs behind the nose and throat, down into the larynx, where the epiglottis, then our vocal cords are housed. Then as we descend down into the trachea, then we're going to run into that carina where the trachea ends and that bifurcation occurs. This is the first split of the bronchial tree. We're going to have the air will go either to the right primary bronchi or the left primary bronchi, which will in turn take it to either the right lung or the left lung. Okay, from there, the splitting will continue of the bronchial tree. The primaries will divide into secondary or lobar branches. Then those lobar branches will split and branch into tertiary or segmental branches, and then they'll get smaller and smaller until they become bronchioles, eventually terminating at the gas exchange sites within the lungs called the alveoli. All right. Now, you might have noticed that I've used multiple terms with some of the bronchial tree. Okay. That's because there are often, and you guys know this already at this point, there are oftentimes multiple correct names for an anatomic part or component. Okay. The primary bronchi, okay, can be called the main bronchi or primary bronchi, whichever you prefer. The secondary branching can be called secondary or lobar bronchi. I prefer lobar because, as we're going to see, once the air makes its way in to the right and left primary bronchi and makes its way into the right or left lung, those next branches, the lobar branches or secondary, are going to be headed toward a respective lobe. So there's going to be 3 lobar branches in the right lung and 2 lobar branches in the left lung. Okay, so I prefer lobar because, to me at least, that's more memorable because I know that the primaries, right and left, are taking them to the right or left lung, right? That kind of makes sense. And then if you think of the next set of branching as being the lobar branches, it's going to continue with that concept where each lobar branch is going to take it to a given lobe of the lungs. And then the tertiary can also be called segmental. Okay, so they're all correct names. Whatever works easiest for you guys at the end of the day, okay? All right. So, air passages and conducting structures, okay? Most of the respiratory system, as I've said several times now, and we saw previously when we had the illustrated the line items of the components of the upper respiratory tract and the lower. Most of the components of the respiratory system are conducting structures. The function is predominantly to allow for the transfer, the movement of air into the body and out of the body, inhalation and exhalation. It's all about free and easy movement, gas exchange, right? However, a secondary function of the conducting structures, and we'll talk more about it in a minute when we talk about the nasal cavity, because this is where this happens for the most part, is in that nasal cavity. And it's a really important secondary function, is that, first of all, that air that's being inspired, that's being pulled into our body from our nose, is filtered, first of all, Okay, remember when we talked about the lymphatic system, when we talked about the MALT tissues, the mucus associated lymphatic tissues, where mucus coats orifices open to the body? Well, our nasal cavity, we mentioned back then the nasal cavity as being one that is, in fact, a mucus coated opening. Again, the idea of mucus coding the entry points that open to the external environment is that we know in our external environment, in the air that we pull into our lungs, into our body, that we inhale, there are pathogens, there are waste products, there are pollutants and toxins, right? Our air isn't pure by any means. So it's the intention, and of course it's not 100% efficient, but it's the intention of the mucus coating of our nasal cavity to try to grab onto any pollutants, pathogens, and toxins that are inhaled and stop them from proceeding further into the respiratory system, prevent them from moving down into our lungs and leading to some type of respiratory infection or distress. Okay? So that's the first thing that's occur is that filtration, much like our tonsils did with our lymphatic system. All right? All right. Then, beyond filtering, very importantly, is that air that we're inhaling from the external environment, particularly on a cold day like today, is being both warmed and moistened. The temperature of the gas that we have inhaled is going to be elevated. It's going to be warmed up and it's going to be humidified. And the reason for that, and it predominantly, again, happens in the nasal cavity. The reason for that is when that air is warmer and more humidified, more moist, it is easier for gas exchange to occur within the lungs. Gas exchange is more efficient. Okay? So that's why it's a secondary procedure. The conducting structures are most important to transport. They're open patent tubes that allow for the transport of air in and out. But secondary is that heating and humidifying of the air coming in to allow for a more efficient, more effective gas exchange in the lungs. Okay? All right. And then we get to the only respiratory structures. Remember, I pointed this out on our list previously. And those are the alveoli in the lungs that technically surround them. Okay? And I want you to know for the exam that the alveoli, like I said, there are over 300 million alveoli. They're microscopic. They're very, very tiny. Okay? But if we would unroll them or dissect them to lay them flat, okay, they have a tremendous surface area. Okay? In fact, if you took the 300 million-ish alveoli that are in your right and left lung and you laid them flat, you rolled them all out flat, they would have this roughly the amount of surface area to cover the entire surface of a tennis court. Okay? So that's a pretty amazing fact when you really think about it, right? Because how in the world could, if you laid a sheet of plastic across an entire tennis court, how could you roll that up so tightly that it would fit within your lungs? It's pretty amazing. But that surface area is really, really important. And remember, back to Bio 210, in fact, the very first day of Bio 210 lecture, we talk about anatomy and physiology and being that form represents or facilitates function. Okay, they have to be interrelated. So the fact that these alveoli have a tremendous surface area is vitally important to their function. In that, the more surface area there is, more point of contacts with the capillaries coming from the cardiovascular circuit, we can have more gas exchange. Okay? So that surface area is very, very important. And also remember that the alveoli are, of course, that site, as you've heard multiple times already and will continue to hear, where actual gas exchange occurs. Oxygen is offloaded from the lungs, specifically the alveoli within the lungs, into the capillaries of the cardiovascular system, and CO2 is offloaded from the capillaries and then exhaled from the lungs. All right, so now we're going to look at upper versus lower. We'll move through the anatomic parts as we tend to always do in these courses, Bio 210 and Bio 211, taking a little deeper dive into each. Some of it will be repetitive, and where it is, we'll kind of move through it a little more rapidly. All right, so we'll start with the nose. We'll start most superior at, of course, the upper respiratory tract. Again, starts with our nostrils, our nares. The nostrils, of course, are external in nature. There are also, beyond the mucus coating the nasal cavity within the nose itself, we also have nasal hairs, and our nasal hairs are also yet another layer of filtration designed and intended to trap foreign particles, any type of pollutants that may be pulled in. Again, by far not 100% effective, but whatever they capture is better than nothing, right? So filtration. All right. Again, the nose has multiple functions. What we've been talking about, a pathway for respiration, inhalation, exhalation. Okay. The nose starts the process, along with the nasal cavity behind it, of moistening and warming that air, leading to more efficient gas exchange within the alveoli, like I previewed for you. We know that filtration and cleaning of that air is going to occur due to our nasal hairs and the mucus-coated walls. And then, of course, within our nose is where our sense of smell exists. This is where our olfactory bulbs and olfactory fibers exist that carry those chemical signals through the olfactory cranial nerve back to the brain for analysis and detection of what it is we're smelling. So the nose, these are the primary functions. Here's a cutaway, a little bit more in-depth look of the nasal cavity, and we'll be talking more about this and looking at this image next week, Tuesday, when we have lab and we dive into the respiratory system. Because it's going to really be important for the lab side of things, but also for lecture, for the exam, that you know these parts of the nasal cavity, okay? And they're not overly difficult at all. There's only two main parts divided into three different regions, and the regions are pretty self-explanatory. So let's start with these ridges, and I'm going to move my cursor here so you can see them. Okay, these ridges are called nasal conchae. Okay, it's a strange name, conchae. Okay, but these conchae, we have a superior conchae, a middle conchae, and then underneath it, an inferior conchae. So fortunately, while the anatomists gave us a bizarre sounding and sometimes strange sounding name of these ridges, these growths of tissue, as conchae, at least they did us a favor by naming them related to where they exist in the nasal cavity: superior, middle, inferior. Okay. And what the conchae do, these physical ridges, is their purpose is to create what are called the nasal meatuses, which are the canals or passageways underneath and between them. These nasal meatuses that are formed by the conchae are the passageways of air that we're inhaling through our nares. Okay, they're not going to go through all three, but the air we inspire will go through one of the three nasal meatuses, making its way back to the pharynx in the back of the throat. Okay, so the meatuses, just like the conchae, are also named by their location. We have a superior meatus, a middle meatus, and an inferior meatus. Okay, so if you can remember that the conchae are the ridges and the meatuses are the actual channels, the tubes, the canals where air passage, the passageways, then you're going to be in great shape. Okay? All right. So our nasal cavity, obviously, like we said, lined with mucus. And if you remember back to Bio 210, when we talked about tissue types, we talked about that pseudostratified ciliated columnar epithelial type that has goblet cells within it, that it's those goblet cells of the pseudostratified columnar that produce mucus. Okay, and it's that mucus again that coats the intranasal cavity with the intention of trapping and attaching to and grabbing onto foreign particles and preventing them from moving further into the respiratory system. Okay, so the nasal cavity internally consists predominantly of pseudostratified columnar that have those goblet cells. All right. Of course, our nasal cavity and our nose is divided from the right side and the left side by a nasal septum that is cartilage based, again, back to Bio 210 and tissue types. And if you remember that cartilage that divides the right and left side of the nasal cavity is hyaline cartilage. Hyaline cartilage is the middle type of density or thickness or pliability. Remember the elastic cartilage that makes up that pinna? Our external ear is the most pliable, easiest bendable. And then the hyaline cartilage is the second most pliable. The fibrocartilage between our vertebrae are the most dense, if you remember back to Bio 210. But this is hyaline cartilage, is that septum cartilage that divides the right and left nostril. And then the floor of the nasal cavity, what separates physically the nasal cavity above it and the oral cavity, that is our mouth. Below it is, of course, our hard palate, those bones that we learned about in Bio 210 at the front of the mouth, the roof of our mouth, and then the soft palate that is tissue deeper within the mouth at the roof of our mouth. All right, and then we've already talked about this slide, so I'm not going to go over this again. These are the nasal conchae again, that are the projections of tissue, superior, middle, and inferior, and then the meatuses, which are the actual canals or tubes or passages that are also labeled superior, middle, inferior, in which the air passes back to the pharynx. Okay? Again, this is where filtering is occurring because of the mucus, but also to enhance gas exchange, heating, and humidifying is also occurring here in the conchae. Okay, and the meatuses. Okay? All right, so now we have another cutaway illustration. Now we're going to move our focus back to the pharynx itself. All right, so I said it starts most superiorly at the back of the throat, right behind the nasal cavity, okay? And then it runs inferiorly downward behind the oral cavity, and then eventually downward into the throat area where the pharynx becomes the larynx and or the esophagus, as we're about to see. So the three subsections of the pharynx, and we'll talk more about this in lab, so you're going to get a second dose of this for sure, is right, again, fortunately the anatomists did us a favor and named these very common sense-ish of where the pharynx, what segment of the pharynx is right behind the cavity that it articulates with. We have the nasopharynx right behind the nasal cavity. We have the oropharynx right behind the oral cavity, that is our mouth. And then the laryngopharynx is where the pharynx and the larynx articulate, where they come together. The pharynx and the larynx, hence the name laryngopharynx. Okay, so pretty easy to remember the three segments of the pharynx and which one is in which order because of the relation to the cavities. Here for the first time, we can see that epiglottis that we'll talk about, and let's go ahead and just introduce it now. Again, this is a cartilage. The epiglottis is a vital component of our body. It is, again, more of I think of it as like a traffic director, okay? We bring food and beverages predominantly in through our oral cavity, through our mouth, right? When we eat and drink. Those food and beverages make their way through the oral cavity back to the oropharynx, okay? We bring air predominantly through our nostrils, through our nares, and through the nasal cavity. That air makes its way back to the nasopharynx, to the pharynx. So we also, of course, as I mentioned previously, can inspire air through our mouth as well. So air, food, and water can come through the oral cavity. So in other words, air, food, and beverages all make their way through the oral cavity and or the nasal cavity back to the pharynx. So because we have all three things coming back, ultimately arriving in the same anatomic destination, our pharynx at the posterior of the throat, we have to have something that can regulate where do these things go once they get to throat level, okay? And that is the epiglottis. The epiglottis is a cartilage flap that consists of elastic cartilage. Remember, we said the nasal septum is hyaline cartilage that is the medium density. It's a little bit more rigid, certainly, than elastic. Elastic cartilage is real easy to move, okay? It's the most pliable. The reason for that is this epiglottis is constantly moving back and forth, steering things one direction and then the other, particularly while we're eating. So our food and beverages, the epiglottis is going to block off the larynx and direct food and beverages down the esophagus, this muscular tube that we'll be talking a lot more about when we talk about the digestive system, toward the stomach, okay? But if while we're eating, we're obviously still breathing, right? So the epiglottis is going to steer food and water, beverages down the esophagus to the stomach. But then when it's air coming in, the epiglottis in turn is going to go ahead and open up and seal off the esophagus, directing that air down into the larynx and eventually down into the trachea, to the lungs. Okay? And then we see our vocal cords, and we'll talk more about those, which are housed in the larynx itself on a coming slide. All right, so pharynx, we talked about this already. As you guys know, I prefer to talk when we have an illustration. Pharynx is, again, that muscular tube from the nasal cavity down to the larynx. The three regions, again, are nasopharynx, oropharynx, laryngopharynx, defined by the region that they occupy. All right, so we have two quiz questions today, two extra credit / attendance verification questions today because we're splitting the chapter. So which of the following is the surface area, has a tremendous amount of surface area, and is the site of gas exchange of the respiratory system? All right, let's continue. All right, so that's the upper respiratory system. We went down through the pharynx. And remember, the lower respiratory system or lower respiratory tract starts from the larynx and everything inferior, okay? So larynx into the trachea, into the bronchial tree, and into the lungs with the alveoli. All right. So again, I've mentioned this several times again, but there is a breakdown into two zones of the respiratory system, the conducting structures. And again, these are all the tubes, the larynx, the trachea, all of the bronchia tree, okay, whether it's the primary or the secondary lobar or the tertiary, or eventually the bronchioles. Those are all conducting structures or conducting zones, all designed to and facilitating the transportation of air, gases in and out of the body. At the same time, cleaning, filtering, warming, and humidifying air being brought in for more effective gas exchange. And then the respiratory zone is the alveoli and the lungs themselves, where actual gas exchange occurs. All right, so let's move down now into the larynx itself. All right, and here we'll see that the larynx starts again where the pharynx ends above it, okay, specifically the laryngopharynx portion. And that is where we're going to find, again, a flashback to Bio 210 when you learned about bones, that hyoid bone. Remember that very, very fragile C-shaped bone in your throat called the hyoid bone, okay? It is the physical connection point of the larynx to the pharynx above it. It's that hyoid bone that is that physical connecting point and the physical separation between the pharynx and the larynx beneath it. Okay, here we see the epiglottis again that we've talked about, that is going to direct food and beverages to the esophagus, which is cut away on this image. We don't see it, but if it's air coming in, where the epiglottis is going to direct that air down through the larynx and ultimately into the trachea. Okay, here we're going to see for the first time a little better view of our vocal cords or our voice box. Okay, and we have two sets of vocal cords. The first one at the top, the most superior of the two, is called a vestibular fold, and it is a false vocal cord. It looks just like the true vocal cord. However, it does not resonate or vibrate and create sound, make our voice. It's underneath it, the more inferior vocal cords that are called a vocal fold, and those are our true vocal cords. This is where our speech, our sound originates. Again, it's all the vibration of air in and out passing through this vocal cord that gives us the ability to speak, create sound. Okay, and then if we continue to move inferiorly, we're going to see cartilage, which is very important, okay? Particularly as we leave the larynx and move into the trachea. And here, because again, this is a sagittal cutaway, we're only seeing one little segment. All the rest of this has been removed. But these tracheal cartilages that are being shown here are C-shaped in reality, and they are cartilage-based, and they have a very important function in that they hold that trachea open, also called patent, okay? It makes the trachea patent, wide open all the time. So the trachea never collapses. And that is pretty obvious why we would want that, right? Because we are constantly breathing. We want to have those gases move in and out of the body through the trachea, for example, from the lungs, with as little resistance as possible. So these C-shaped trachea cartilage elements hold the trachea open, keep it patent, so that air can easily move in and out through the conducting structures. Okay, that's going to be important for both the lecture exam and the lab quiz, to know that these cartilage rings of the trachea keep the trachea patent, open. Now, the esophagus, spoiler alert for the digestive system, is a muscular tube that we saw runs behind. Of course, it's cut away, like I said here. But it actually flattens out. When food and beverages aren't being passed through the epiglottis toward the stomach, the esophagus flattens out to give the trachea more room for air movement. So they're very different, the esophagus and the trachea. They're both tubes running through the throat, but very different in how they look on a moment by moment basis. All right, so the larynx functions, we've talked about this, right? The larynx, we have our voice box in there. We have the hyoid bone that we've talked about. We talked about the laryngopharynx being the contact point or the articulation where the pharynx becomes the larynx, and then eventually the larynx, as we continue more inferior, becomes the trachea, okay? And the larynx's most important job is to provide that patent open airway for gas transfer, okay? Within the larynx, of course, is where the epiglottis is. That's going to, again, as we've mentioned, route air and food to their proper tube, esophagus for food and beverages, air to the larynx, and eventually the trachea. We all know that that's not 100% effective, right? Sometimes our epiglottis fails us, and we take a big sip of soda, and it leaks past that epiglottis and makes it down into your trachea, and you start to gasp, right? You're going to have a gag-like reflex because our lungs don't want fluid in them. And then, of course, our vocal production. All right, the epiglottis, we talked about this before, so I'm not going to talk more about it other than to emphasize what I've shared with you previously to know for the exam. Remember, our nasal septum is hyaline cartilage, not the epiglottis. The epiglottis is elastic cartilage like our ears. Know that for the exam. Again, form meets function. That elastic cartilage type is the easiest type to bend, and that epiglottis is moving a lot, particularly while we're eating. All right, so on to an illustration of the lower respiratory system conduction zone, the tubes that bring gas in and out of the body. Okay, remember I told you that I was going to tell you where your second matching question was. The first one was back in the cardiovascular unit that we've talked about multiple times. But this is the second of three. On Thursday, we'll have your third of three. Okay, but this is a matching question. It's the literal illustration of what you're going to see. You are going to definitely want to know these structures that we're about to talk about, and we've already been talking about, and we'll continue to talk about, not only today, but Thursday in lecture and Tuesday in lab. We're going to talk about them multiple times, so you shouldn't have any problem with them. Because like I said at the very beginning of this lecture, there aren't a lot of parts of the respiratory system. Okay, but the conducting zone structures that you want to know and be very, very knowledgeable about, not only their names, but what happens in them, are going to be that trachea that we're talking about. So now we have a cutaway where even the larynx above it has been removed. Okay, we have the trachea, which, by the way, is only roughly 4 inches to 5 inches long. It's really not a super long tube or structure. Here you can clearly see those C-shaped cartilage rings, though, that maintain patency of the trachea. Keep it open. Okay? That trachea, as that air being inhaled, being inspired, is making its way down and in toward the lungs, is going to then hit that carina that I told you about. The carina is the most inferior aspect. It's the terminal endpoint of the trachea, okay, is called the carina. You are definitely going to want to know the name of the carina, both for lecture and lab. All right, and then when the trachea ends at the carina, the bifurcation, the splitting, the initial branching of the bronchial tree. The trachea is one solid branch, like a tree trunk. Now we're going to turn into two, a true bifurcation. we're going to have a left main or primary bronchus, and then a right main or primary bronchi. Okay, and they are going to take that air respectively to either the left lung or the right lung. Okay, so the primary or main, again, two names equally appropriate or accurate for the same primary bronchi. They only carry air, gases we're inhaling from the trachea as far as getting into the lungs. Immediately, once they're inside of the lungs, they're going to start to branch again. Okay, much like our cardiac vessels did. They're going to get more numerous, but smaller in diameter. All right, we'll just look for illustrative purposes over here on the left-hand side. And I said that the primaries are the first branching, and then they become either lobar, headed toward each lobe of the respective lungs, or you can call them secondary bronchi. Okay, and I said previously, I'll say it again, I prefer to remember them as lobar because to me that's easier, because the primaries, again, are easy to remember because they're taking the air coming down the trachea in a primary fashion to a lung, either the left or right. And then once inside at the first branching of the bronchi, of the bronchi, if you remember lobar, they're headed toward a given lobe. Okay, so here we can see that this lobar branch right here is headed toward this superior left lobe of the lung. And this lobar branch is headed toward this inferior lobe. Over here on the right, where there's three lobes, we have a lobar branch here that is taking the air, the gases inhaled to the superior right lobe. This branch coming down here is taking the lobar branch, is going to the middle lobe. And then this lobe here is coming to the inferior lobe, all the way down. Okay? So lobar go to a lobe, 3 on the right, 2 on the left, just like the number of lobes that we have because of the space for the heart. And this again is called the cardiac notch in the left lung. Okay? All right. And from there, the next branching that's going to occur of the bronchi are going to be from lobar or secondary into segmental or tertiary, whichever you prefer. And then remember, from there, you're going to have tremendous amount of branching that's going to occur, and they're going to become bronchioles, which eventually will terminate at the alveoli, as we'll see in a few minutes.
Excuse me, sir.
Yes.
Please, can you, sorry to pull you back, can you repeat the airflow again one more time, please?
Okay. From the trachea coming down, and when that
Yes, when it
airflow,
comes up. Yes, sir.
okay, and then that trachea, when the airflow comes down, it's going to hit the end of the trachea, which is called the carina, and now it either has to go right or left, into the right or left lung. So it's going to go through what's called the primary bronchi, the left primary if it's going to the left lung, the right primary if it's going to the right lung. And then from the primary, as these bronchi branch off and divide themselves, they're going to become lobar branches. So a left lobar branch that here is headed toward the left, the superior lobe of the left lung, and then this lobar branch is going to be headed toward the inferior lobe of the left lung. And then when they branch the next time, they're going to turn into what are called segmental or tertiary bronchi. And then we can't see them here, but we'll see them in a little while. Much smaller. Again, they can be thought of as almost the equivalent of capillaries in the cardiovascular system. These segmental or tertiary bronchi are going to branch into very, very tiny, but thousands and thousands of them, bronchioles. They get the smallest. Okay? All right. So we talked about this. You're very welcome. You're very welcome, sir. So we talked about this before when we were looking at the illustration, so we'll move a little more rapidly through this. We're looking specifically and talking about this trachea portion here from the larynx to the carina. Again, like I mentioned previously, only 4 to 5 inches long. And again, this is where it's really important that I've emphasized multiple times to you, is that it is held open by C-shaped cartilage rings, which we can clearly see here, okay? These rings to keep it patent, keep it open so air can flow with as little resistance as possible, both in and out of the lungs. Here we see an imaging, an ultrasound type image for the first time using contrast so we can actually see an image of the bronchial tree. And you can see why they refer to it as the bronchial tree. It really looks like either the roots of the tree, or if you flipped it upside down, a tree with all of its limbs and smaller branches, right? And that's why the term branching is used also. So we can see here there's a cutaway in this imaging study. The trachea, we can only see a little bit of it. It, of course, continues through here, but that's been removed in this imaging slice here. But this is the trachea. And of course, this is the carina of the trachea where it ends. And then, of course, we're going to start that first branching with the primary bronchi, left and right, and then the lobar branches, and then, of course, becoming the tertiary branches. And then eventually, we can see some bronchioles as we get way out distally, they get very, very significantly smaller. Okay, so they become just like the cardiovascular system. They become more numerous, more of them, but smaller in diameter. All right, so this is what we just talked about, so I'm not going to talk about it again. Again, trachea into right and left, primary bronchi or main, whichever name you prefer, then branching into lobar or secondary. The lobar and secondary then branch into segmental or tertiary, whichever you prefer. And then eventually the segmental tertiary are going to become bronchioles, getting smaller and smaller, but more and more of them. And eventually the bronchioles at their terminal aspect, where they end, is where you're going to find the alveoli that we're going to talk about in a minute. All right, so here are the alveoli. Finally, we see an image of these alveoli that I've been referring to throughout the cardiovascular system and now the respiratory system. Okay, remember I said, I like to think of them as bunches of grapes. That's what they look like to me, a cluster of grapes, right? Remember, these are microscopic. There are over 300 million. And if they were laid flat, there would be enough to cover the entire surface of a tennis court. Okay, these are the sites of actual gas exchange between the lungs and the respiratory system and the cardiovascular system, and very specifically that pulmonary circuit that we talked about, the deoxygenated blood coming to the lungs and then the reoxygenated blood headed back to the heart. And if we look on this illustration, we can kind of see the illustrators here showed us some capillaries, these string-like appearings on top of the alveoli. They're supposed to represent the capillaries that are laying over the top of the alveoli, just showing that intricate relationship between the capillaries of the cardiovascular system and the grape-like structures called the alveoli of the respiratory. All right, so again, I've talked about the number of alveoli. I've talked about these are the sites of gas exchange over and over again. So we'll move down to what are the alveoli actually constructed of tissue-wise? And the answer is there's two different types, okay? The first one mimics what we saw, is the same as capillaries over in the cardiovascular system. That simple squamous epithelial tissue, okay? paper thin, one layer, very thin to allow for gases along with other things to diffuse, to pass through the wall of the capillaries, right? With very little effort. And then also through the walls of the alveoli. And carbon dioxide, remember, coming from the heart, that deoxygenated blood, that carbon dioxide inside of the lung at the alveoli is going to jump off of the erythrocyte, pass through the simple squamous tissue wall of the capillary, through the simple squamous epithelial tissue that is the alveoli. And now that carbon dioxide, that waste product from cellular activity, can be exhaled and recycled back to the external environment outside of our body. And then the opposite is true with oxygen. We inhale oxygen, the oxygen from the alveoli will go through, of course, the conducting structures that we just talked about at length, end up in the alveoli. The oxygen molecules will pass through the simple squamous epithelial wall of the alveoli, through the simple squamous epithelial wall of the capillary, onto the red blood cell, the erythrocyte. Now the blood is oxygenated, and it's going to start its return back to the left atrium of the heart, oxygenated. All right? So the bulk of the alveoli, from a tissue standpoint, are simple squamous epithelial tissue to allow for gas exchange, the very function of alveoli. However, unlike capillaries, which are just simple squamous epithelial tissue, the alveoli also have some intermittent, randomly scattered cuboidal epithelial tissue. Remember Bio 210, we had those cube-shaped epithelial tissue called cuboidal. Okay, there are some randomly scattered cuboidal cells within the alveoli, and that is very much by design. Okay, let's go back for a second, that the simple squamous epithelial tissue that facilitate diffusion and gas exchange are called type 1 alveoli cells, or tissue types, okay? The scattered cuboidal are referred to as type 2 alveoli cells, okay? And what these scattered cuboidal cells do is they secrete a lubricant called surfactant. And you can see that that's really important for you to know, that these scattered cuboidal tissues, cells, scattered on alveoli, are type 2 alveolar cells, and they secrete a lubricant called surfactant. And I'll help you to remember that they secrete surfactant by telling you what it does. You can think of surfactant as being a water repellent, okay, like a car wax, okay? And the surfactant, like Teflon, for example, in a frying pan, okay? It prevents the acquiring of water, okay? It's going to make water shed. And why that's important is when gas exchange is occurring within the lungs at the alveoli, a byproduct of that gas exchange is water, okay? The creation of water is a waste product that's created because of gas exchange of the alveoli. Remember, those alveoli are paper-thin, simple squamous epithelial tissue. And that water, if there wasn't surfactant, that oil that repelled water and caused it to run off of the alveoli, that water would be heavier than the surface of the alveoli, and the buildup of that water would cause the alveoli to collapse. And if they collapsed, not only could they not transfer gases, but they would lose surface area because they'd be compressed and collapsed, right? So the surfactant that's dispersed by the type 2 alveolar cells, scattered cuboidal, that surfactant coats the alveoli and makes that waste product water run off of the alveoli so they don't collapse. Okay? Hopefully that helps you to remember why surfactant is important. Second, and the final of your extra credit questions for today / attendance. How does the trachea stay patent or open? What anatomic structure help maintain the patency of the trachea? All right. Couple slides left and we're done for today. And I'll let those of you that have not worked on your lab quiz yet get over there. Okay. So let's talk about the lungs themselves and the pleura, specifically the serous membrane that we learned about back in Bio 210 that encapsulate and protect the lungs. Okay, so we see anatomically here in the thoracic cavity, remember the thoracic cavity, again back to Bio 210, is everything superior to the diaphragm muscle. And we can see from looking that the vast majority of the thoracic cavity is occupied by the lungs. Okay, the lungs fill the vast majority of the thoracic cavity. Of course, we have the heart, we have the trachea, the esophagus, the thymus gland, some other things, but the bulk of the thoracic cavity is filled and occupied by lungs. Here we can see the first labeling of that cardiac notch, the cutaway of the left lung to make space and accommodate for the positioning of the heart. Of course, it's been removed for this illustration. All right, so what we haven't talked about yet is how do the primary bronchi make their way into the lungs? When we think of lungs, okay, we think of almost like balloons, right? Because they inflate. As we inspire air, the lungs expand and get larger. And as we exhale air, they contract and get smaller, right? So therefore, we never want our lungs, obviously, and barring trauma, they never do completely deflate. They're always going to remain partially inflated. Okay, so much like a balloon, they have to stay sealed in order to not deflate. So how do those primary bronchi and other things make their way into the lungs and yet the lungs stay sealed? And the ports of entry on either side, on either lung, right and left, are called the hilum. The hilum is just an airtight opening, a seal on each lung. And in the middle area, in that mediastinal area where the primary bronchi would pass through, okay? And not only does the hilum, that airtight sealed opening, allow the primary bronchi right and left to make their way into the lungs, but also remember, our lungs are organs that are living, breathing, functional organs. They need blood. They need oxygen, they need nutrients, they need ions and enzymes and everything else that all the other organs and tissues need. So we have to have blood vessels, arteries and veins going inside of the lungs. We have lymphatic vessels going into the lungs through the hilum to remove waste. We have nerves, nervous system components that are making their way into the lungs. So anything that makes its way into the right or left lung have to make their way through the hilum on the right and left lung. Remember that for the exam, that the hilum is that airtight, sealed opening that allows everything and anything that's going to make its way into a lung or out of a lung. It has to pass through the hilum. Okay? And then we talked about the lobes already previously and at length. All right, so the actual composition now of the lungs themselves, let's talk about. Okay, so of course, the bulk of the weight of a lung is going to be alveoli. Again, 300 million of them tightly compressed within the lungs. But the exterior surface of the lung consists of a surface called stroma, okay? And that stroma, the outer surface of the lungs, the tissue type back to bio 210 is that elastic connective tissue. Remember, elastic connective tissue is, we use the illustration, at least I do when I teach bio 210. Elastic connective tissue has those elastic fibers in it. For example, in our skin, that allows our skin, if you pull it away, to snap back into place. Think of elastic in the clothes that you wear, right? You can pull it loose, but if you let go, it'll snap back into place, okay? That's important for the connective tissue to be elastic connective tissue when you think about our lungs, because our lungs, again, change shape and size. As we inspire and inhale, those elastic fibers need to stretch and distend. And then when we exhale and the lungs return to normal size and get smaller, they need to snap back into place. Okay? That kind of is common sense. All right. So our lungs have two different types of blood supply and nerve supply coming to the lungs. And we've already talked about this, and I think you guys already know this. We'll talk about it real briefly here, but there's pulmonary circulation and then bronchial circulation. Okay, the pulmonary circulation, again, are those veins and arteries that bring deoxygenated blood to the lungs for gas exchange. Remember, coming from the right ventricle to the pulmonary trunk to the pulmonary arteries, two of them going to the right and left lung, making their way in eventually to the capillaries of the pulmonary circuit. At the capillaries that touch the alveoli, gas exchange occurs, and then oxygen is onboarded, and then that oxygenated blood is going to make it back via 4 pulmonary veins from the body, from the lungs, back to the left atrium of the heart, right? Gas exchange from the heart to the lungs, back to the heart. That one we've talked about, pulmonary circulation. So that's all about gas exchange. But not how do the lungs or any components of the lungs receive their nutrients and oxygen, and that's the bronchial circulation. These are those arteries and veins that come in through the hilum that provide oxygen and nutrients to the lungs themselves, okay? And of course, remove waste back via veins, back to the heart, just like any other organ. So pulmonary circulation is gas exchange from and to the cardiovascular system through the lungs. Bronchial circulation is arteries and veins taking nutrients and oxygen to the lungs and all of its tissues, and then removing waste like any other organ. All right, on to the serous membrane, specifically the pleural serous membrane. Remember, there were 3 of them, one for the heart, one for the lungs, one for the pericardium of the abdominal organs, the pleural serous cavity. Remember, the serous membranes are a double layered sac, if you want to think of it at that, okay? There's 2 layers and then inside those 2 layers is serous fluid, gel-like fluid. The point of the serous membranes, in this case, the pleural serous membrane, is that it totally encloses, encapsulates the lungs, and it is there to protect and cushion the lungs and prevent friction and erosion and heat buildup, wear and tear. Okay, because you can think about it when we think about our lungs and what they're doing all day and night, right? They're changing shape, they're enlarging, and then they're constricting. And if there was no serous membrane, no protective sac, that pleural serous membrane that has lubricated gel in between it to eliminate friction, our lungs would be rubbing on our rib cage, for example. Okay. And if our lung tissue, that stroma, was rubbing on our rib cage, we would have wear and tear and we would have inflammation. And eventually we'd have that lung tissue disintegrating and breaking down. Same with the heart, same with the abdominal organs. Okay. So it's all about cushioning, protecting, and most importantly, especially with the heart and the lungs, reducing and eliminating friction. So there's no bone on bone contact when there's movement of the heart and the lungs. All right, there are two layers that I mentioned of the pleura of the serous membrane. The parietal layer is that most superficial layer. Okay, and that is located on the inner surface of the body of that cavity area. In this case, the inner surface of the thoracic cavity, because that's where our lungs are. And then the deeper layer is the visceral layer. And that's going to be, in this case, for the pleural serous membrane, going to be on the surface of the lung. And then in between that is going to be that serous fluid. That should all be a recap. Hopefully you guys could have taught me that. That's Bio 210 stuff. All right, that's it for today, guys. That'll take us to respiratory physiology when we meet on Thursday. Like I said, can't emphasize to you guys enough, be here for respiratory physiology, okay? It's a lot more heavy lifting, a lot of new concepts. Many times people learn a lot of things about how we breathe, things that we assume we think we know how it works, and we really don't. Okay, so don't miss that one. All right, don't forget, send me your extra credit / attendance verification within the next 15 minutes. If you haven't already, I hear my email chiming, so I know you guys have been dropping those to me already. That's great. And then if you haven't taken the lab quiz, don't forget, have it completed by 8 o'clock. Has to be finished by 8 o'clock so you don't rack up a 0 on that lab quiz, okay? Any additional questions beyond the ones that we've had so far? All right, outstanding. Guys, have a good luck on your quiz today if you haven't already taken it. Remember with the lab quizzes, don't pay any attention to the preliminary grade. Wait until I hand grade it and put it in the grade book, okay? And then we will see you guys in 2 days on Thursday for respiratory phys.